Hi everyone, we are excited to have you here in today's fun-filled learning session at YOLO. Here is a quick look at how you can submit your work after the class. As a first step, go to live.yolo.com. You can use any browser to access this site. On this page, you will see a list of all our classes. Scroll down and you can see the Submit Your Work button. And then you will see a list of the classes that you've last attended, which could, for example, show the dance or craft or science experiment classes you've attended recently. Next, it will show you the list of children whose names are registered in this mobile number. Choose your name from this list to submit your work. For instance, if you are Satvik Kumar, choose that name. And then choose the class for which you would like to make your submission. For example, if you've attended the New Year's Masquerade Party session and you'd like to make the submission for this class, click on the Submit Your Work button below that. And then upload the photo you've taken. Choose the image from your phone and click Submit. You can scroll down and view all your past submissions and see how many of your friends or peers have liked your work. You can also see others' work and like their work to inspire your friends. If you want to showcase your work on social media, that too is very simple. Click on Share, copy the link and post it on Instagram or Facebook or any other platform of your choice. Just a tiny reminder, your submission looks a lot better if you could click a photo in the landscape mode rather than the portrait mode. Do not forget to tag us at YOLO_app. I'm eagerly looking forward to all your submissions right after this class.
Hi there, kids. How are you doing? Welcome back to our COVID or coronavirus classes that we have been going ahead and taking. Today is the fourth class of our 5 class session, and I am so happy and glad to have you back. All right, so let's get started off by talking a little bit about the feedback program, then a little bit about the certificate program. Then we can talk about what we're going to go ahead and do in today's class, as well as then we can go ahead and talk about the list of materials that we will be using today. So starting off with the feedback program. What is the feedback program? Really, really simple program. It's just a program wherein you will go ahead and get a personalized feedback from me if you get selected as part of that top 10. So for that, firstly, you obviously have to go ahead and do all of your submissions. So if you make your submission, then you will get selected. 10 of you will get selected as part of the top 10. So if you're doing a good job and a neat job, then you will get selected as part of the top 10. And then you will go ahead and get feedback from me. Now, in terms of feedback, I'm going to be giving you 2 kinds of feedback. The first kind of feedback basically is feedback wherein I'm giving you positive feedback as to what you're doing good, what you're doing well, and how you can go ahead and continue doing it. And you can develop that skill further because you're already good at it. The second kind of feedback that I will be giving is basically a little critical feedback. What I mean by critical feedback is the feedback in which I will probably be providing you information on how you can go ahead and do things a little better, and how it will make you a better artist or whatever skill we're talking about at that point of time. So how you will get better at it. So that is also going to be a very important kind of feedback which you definitely want to go ahead and get. Now, the second thing that I wanted to discuss with you about was the certificate program that we have going on. It's a really simple program. Whatever course you're taking up, whether you're taking this course, whether you're taking the sketching course, whether you're going ahead and taking a dance course, whatever it is, then go ahead and attend all of your classes and definitely make all of your submissions. If you go ahead and do both, then by the end of it, you will go ahead and get a certificate for your work that you've been putting in. Now, I know all of you are already going ahead and attending the classes, so it just makes extra sense for you to, make sure you do things on time. So automatically you get a certificate at the end. Now, why is it that I'm insisting you to go ahead and get a certificate? Because the certificate is really, really important. It's sort of like an identification of all the skills that you have learned, and you can go ahead and show people. So, whatever you've learned, you can go ahead and tell them that, look, this is what I've already learned, this is what I know. And your teachers, your colleagues, your peers, everybody will be aware of the skill set that you already have, which is very, very very important. It's good to go ahead and provide information of what your skills lie in. So very, very, very important. Make sure to go ahead and do that. Now, let's go ahead and talk about today's class. Now, today's class is going to be very specific to precautions, preventions, and the whole vaccination concept that we have going around in terms of coronavirus now, or COVID-19, whatever you want to go ahead and call it. Now, we have dwelled upon this a little bit here and there in the first class, second class, third class. Everywhere we've gone ahead and spoken about it in bits and pieces. Like when we spoke about the symptoms, you obviously know if you have certain symptoms, how you're supposed to act on it. If we've gone ahead and spoken about how we have maintained social distancing through the lockdown, how there were preventive measures and things like that in the second class, where we discussed about how it affected the world. But we haven't really sat down and made a list of all of the precautions, preventions, and the whole vaccination system that is currently going around in the world. Now, what is the importance of this class? The importance of this class is basically to go ahead and provide a complete and full-fledged list to you, so that you can go ahead and provide that to yourself, your friends, your family, whoever it is that will probably need it tomorrow. Even if nobody needs it, it is fantastic to have this information, because it might come handy later on in the future if something happens to someone, or if something doesn't happen to anybody close to you. Then when someone is confused and they do are facing that form of problem later on, it could be a family friend, it could be a friend's family, so on and so forth. If anybody is facing something like this, then you having the information will provide a good amount of help to anybody. So having that little bit of information really, really helps, and I definitely want to provide that to you today. So what we're going to go ahead and do is we're going to first start off with all of the precautions that you have to take. Second, we're going to talk about all the preventive measures that we're going to go ahead and take. And lastly, we're going to go ahead and talk about the vaccination drive that we have. Now, all of this is sort of interconnected to each other, so make sure to go ahead and get a good gist of all of the things that we're going to be talking about. Now, if you are attending this class for the first time, then so how we go about with this class is really, really simple. We start off by talking about everything, and we also draw along. Now, today's class is again going to be a colorful class. We're going to go ahead and use different color sketch pens for doing our work today. If you want to go ahead and do it with a black sketch pen and color it in later, that is completely up to you. I just want you to go ahead and create the doodle poster that I am going to be creating with you, and that's also going to be your submission. So make sure you do a good job. If you're feeling a little uncomfortable directly drawing with sketch pen, then you can definitely go ahead and take a pencil and draw everything out, and then later move on to sketch pens. That's completely up to you. So let's get started. So the first thing that you need for today's class is going to be a sheet of paper. Now here you can go ahead and take a 150 GSM sketchbook, drawing book, journal book, or an A4 size sheet of paper, or an unruled sheet of paper. Any of the following would work. Whatever you have with you would work. Now, the next thing that you need for today's class is going to be a set of sketch pens. Like I mentioned, if you're going to be going ahead and using a set of sketch pens like I am, then have like a good range of colors. You can go ahead and use whatever colors you want to use. You don't have to specifically use the colors that I am going to be using. If you feel like you want to draw with a pencil and then later get back to using a sketch pen, completely all right. Go ahead and do it the way you want to go ahead and do it. Now let's get started about all of the precautions and preventions that I wanted to go ahead and talk to you about. So the first thing that we're going to go ahead and talk to you, like I want to talk to you about, is basically about personal health and hygiene. So what I'm going to be doing is I'm going to firstly go ahead and draw one bit. So we're going to go ahead and draw a hand wherein someone is going ahead and washing their hands. So we're going to go ahead and take a brown color sketch pen to draw the hand, and I'm going to take blue color color to kind of draw all of the lather and the bubbles and the soap that we get when we wash our hands. So that's the first thing that we're going to be going ahead and drawing. And while you're going ahead and drawing this, I'm going to talk to you about the basic precautions that you need to go ahead and take. So firstly, what do I indicate by washing your hands? So like coronavirus spreads from water droplets. It spreads from coughing, so any form of phlegm or saliva, whatever it is, it spreads from all of that. It can sit on any water surface. So for example, it can sit with water. It can also sit with your sweat. And finally, it can also be airborne, so any form of air that you're talking with, etc., that carries the virus, it can spread with that as well. Now obviously, it's very common to go ahead and go ahead and touch a lot of things around you. So for example, if you've gone to the playground and you've gone ahead and played on the swing, then you touch the swing. If you're going in an elevator and you've pressed the lift button, then that. If you're going ahead to a mall and you're holding the railing, then that. So all of those places are places where different people are touching the surface many times. So one of the major precautions that you can do is, try avoiding touching whatever you're touching. But if you cannot avoid touching whatever you're touching, then come and wash your hands. And the concept of washing your hands is basically washing your hands for 20 seconds fully. And there is a whole procedure on how you wash your hands to get rid of the virus from your hand. So if you do not know how to go ahead and do that, please look that up, because there are around 6 to 7 steps on how to go ahead and do it. So that's something that you have to keep in mind. So that is the first one. And now, same in relation to that, let's go ahead and talk about the concept of masking our face. Now, the concept of masks became very important, and it is one of the most important precautionary measures when it comes to coronavirus itself. If you wear a mask, then what happens is you're going to go ahead and prevent yourself from someone going ahead and spreading the virus to you, and if you have this virus and spreading it to someone else. Now, it's not as simple as just putting on a mask. There are many ways in which you can wear your mask, and it's very important to do it right. So the first thing that is very important is to go ahead and cover your nose and mouth fully. You do not want to go ahead and leave it under your nose or leave your mouth open or have it hanging anywhere. You want it to be fully secure on your nose and mouth. So that's the first thing that is very important. Second thing that is very important is to not have gaps anywhere. So whether it is the top part or the side part or the bottom part, not to have any gaps anywhere, so that the virus can come through. Now, if you are updated with the current situation in India, how we have the virus spreading again, which we will talk about in the next class, the new precaution that has come up is to always double mask. Now, till now, we've been either using a surgical mask or an N95 mask or a cloth mask, and we've been using only one of the masks. But now the new rule basically is for you to go ahead and wear two masks so that you are extra protected. So what I would suggest for you to do is wear a surgical or an N95 mask, and make sure it is clipped down on your nose and then all the way on the side, and then finally have a cloth mask on top. It's going to be very important in protecting you and your family. Now, I do understand we are all in lockdown, so we are not going out as often, but if you are going out often, then go ahead, or even to buy groceries, go ahead and double mask for a fact. Now, third thing is basically going to be to sanitize as much as possible. So here I'm going to go ahead and draw a sanitizer bottle. And now sanitization, which is a a sanitizer, as well as washing your hands, I do understand becomes similar, but why I am putting them as a different categories, I will explain to you in a bit. So look at how I'm drawing this. I'm drawing a rectangle with a label, and then I'm just drawing the bottle with a few droplets coming out. So this is going to be my sanitizer here. So while you draw this, let me explain to you why there are two different categories. So what I would like for you to do is that you can't always go ahead and wash your hands when you are outside. If you, for example, go out into the lift and you're going downstairs to buy something, then have a sanitizer with you. What you can do is you can always go ahead and sanitize your hands between touching things. And a lot of the times I do understand that one of the biggest precautions that they tell us when we are out and about is to not touch your eyes, nose, or mouth. Now, nose and mouth you have covered because of your mask, but your eyes is something as well that you should not touch. Now, I do understand it can be hard for you to not touch your eyes. So, one of the biggest ways that you can prevent from, getting harmed or, getting the virus and catching the, virus itself is sanitizing wherever you go. So, if you touch anything, immediately sanitize your hand. Just make sure to keep that as a habit. If you keep that as a habit, what's going to happen is you're immediately going to keep preventing yourself from getting the virus. So sanitize your hands so that you don't have to be cautious about whether you're touching your eyes, whether you're touching your mouth, your nose, whatever it is. You are always sanitizing, so you're always on the safer side. So those are two different things, hence I have made them. Now, another thing that is a very, very big preventive measure in terms of COVID-19 is, your immunity. Now, even if you do get COVID-19, you can basically not be detected for COVID-19 because you might fight off the virus even if it comes into your body. So, a lot of us can fight off the virus if we are healthy. So, for this, I mean eating healthy food, drinking healthy water, going ahead and having your vegetables, going ahead and having all of that. So, in the similar way, since I've drawn a bowl of soup, which is all very, very healthy, I'm also going to be drawing a glass of, warm water. So, here, why I am drawing this is obviously you want to keep your diet healthy, you want to exercise, you want to build your immunity. But another thing that you want to really, really pay attention is to your respiratory system or your lungs. Now, the reason why I'm talking about your respiratory system and your lungs mainly is because that is what is going to work in terms of, keeping the virus away from you. So, if your throat is healthy, if your lungs are healthy, then what will happen is you will be healthy. So, one of the forms that we have been following in our Indian society is drinking warm water, not, letting anything affect our throats, taking care of our health, not eating too much fried food. All of that is something that's going to really, really build up your immunity. So try to keep that as one of your very, very important preventive measures for COVID-19, which is having a great immunity system. Now, apart from that, I'm going ahead and going to draw a bunch of medicines, like you can see right here, very, very simple, as well as I'm going to go ahead and draw a hospital symbol of a plus. Now, the two of these are associated to healthcare and also the concept of keeping your health good. Now, I do understand immunity is a one point of it where you need to be immune to the virus itself, that you need to be healthy enough to fight the virus if it does come to you. But another important thing is that you may fall sick or you may not, depending on whatever you are part of. You may or may not fall sick during the pandemic. If you do fall sick, if it's not even the virus related sickness that you might have, maybe you just have a very normal cough or a very normal cold, or you just played a lot and you're tired, that's completely okay. But what is important to do is, in both of those cases, if you are sick in any way that is not related to the virus, to take all the precautions to get better. So if you need to go to the hospital, then go to the hospital, take all the medical attention that you need to get better. So any form of illness that you have, disease, whatever, take extra precaution so that you stay healthy through and through, because you do not want to have like already an unwell body as well as get the virus. So it is going to help you and your friends and your family to be as healthy as possible, and that involves taking medical attention whenever you need. So that is also a very important um, you know like point in terms of prevention. Now let's talk precautions. Now let's talk about some preventive measures. Now what I mean by preventive measures are how the concept of spreading the virus will reduce. So first thing, which we've already discussed several times already, one of the major preventive measures for the virus spreading is going to be to maintain social distancing. Now at this point of time, since we are in lockdown, or in the future once we get out of lockdown also, one thing that is very important is to maintain social distance from people. What it's going to basically do is it's going to provide for, like, the spread of the virus will basically reduce as there is a distance maintained. So make sure of that. You want to go ahead and follow social distancing, whether you're going ahead to buy vegetables, whether you're going to go ahead and buy some basic stationaries that you need, whether you need to go ahead and buy any essentials like milk, whatever it is. Even during lockdown, after lockdown, whatever it is, maintain as much social distancing as you can. Even if you know that someone is safe, try to go ahead and follow it, because you do not know what situation can arise tomorrow. Another thing that is very very important, and I want you to take into consideration, is to stay at home as much as possible. That is one of the other biggest preventive measures when it comes to the virus itself. Now even when you are at home, there are many preventive or precautionary measures that you can take to avoid getting coronavirus. Some of those include everything that I spoke about in terms of washing your hands, wearing your mask, eating well, exercising, all of that for sure. But apart from that, you can also go ahead and have precautions, such as if something gets delivered to your house, whether it's food, whether it's a package, if you get a courier, anything that you get at home, make sure to either leave it for a couple of days before you open it, so that all of the virus dies from that package or whatever you have. Or at least get yourself a sanitizer spray to go ahead and spray all over the package, so that you do not go ahead and get infected. Now this is a very very important and vital part, because if you stay at home, automatically you're not meeting people, and automatically you're not spreading the virus. But the virus can come home as well, and in order to save yourself from that, go ahead and do this little bit of it. Go ahead and get a sanitizer spray and sanitize things. It's a fantastic preventive way that you can possibly have. Now, the next thing that I want to go ahead and talk about is, the concept of traveling. Try as much as possible to stay at home. Try not to go out. Try not to travel. Right now, like I said, we are many of our states are already in lockdown, so we do not have the option of basically going outside. But if you do have an opportunity to go anywhere, try as much as possible to stay at home and try not to meet people. The lesser number of people that you meet, the more safe you're going to be when it comes to the virus. Now here I'm going ahead and drawing a building, and I've drawn a car right next to it. Now the reason why I've gone ahead and done this is because this is going to be every place that you can possibly go out to. So it could be the mall, it could be a friend's house, it could be school, it could be work, whatever it could be, a place, a building. Try as much as possible not to travel. Try not to go out to restaurants. Try not to do all of those extra things. Go out and do only important and essential things, because that's what is going to keep you safe at home. You need to go ahead and be very very preventive of getting the virus, especially since you are all very very young. Now, here we have gone ahead and spoken about both the preventive and the precautionary measures for coronavirus. But one thing that we haven't discussed is about the vaccinations that we have going around in the world and in our country. So let's go ahead and draw a syringe to identify it as the vaccine that everybody is going ahead and getting. So I'm just going ahead and drawing that out. Perfect. So now what is a vaccine? That is something that everybody might be a little confused about. Like, what is a vaccine? So vaccine is basically something that is given to you that helps you fight COVID-19 or coronavirus or frankly anything. So you have separate vaccinations for separate diseases or separate illnesses or separate conditions. Now here the coronavirus vaccine was developed in India as well as in different parts of the world, and there are many that have already been approved, and the concept of giving out the vaccination has started. The first thing that happened when people needed to start giving out the vaccine, and this was basically in India and all around the world, is everybody who is working as part of the healthcare system was given the vaccine first. So all of those people who come in contact with the coronavirus patients, all the people who work at hospitals, all the people who work at pharmacies, all of them were the first set of people to go ahead and get the coronavirus vaccine, and that was very, very important. Now after that, the concept of giving the vaccine depended from people to people, depending on which country they were in and how much accessibility of the vaccine they had. And there are different vaccines. For example, in India you have the Covaxin, you have the Covishield. Abroad you have Covishield, you have Pfizer, you have J&J. You have different vaccine names that have come out, and there are different vaccines available in different parts of the world. And every country is coming up with their solution and their way of providing the vaccines to their public. In India, what we have done is we have obviously gone ahead and given our healthcare workers the first set of vaccines. But after that, the people who are on the older side, that is 45 and above, whoever had comorbidities and later who did not even have comorbidities, were the first set of people to go ahead and get the vaccine. Now the reason why you basically the first people who had comorbidities, that is, if for example someone who's older than 45 years old and has diabetes or has blood sugar or has a heart issue, will be will has more susceptibility to falling sick and being have a very bad reaction to COVID-19 itself. So for them to get the vaccine was very, very important, because then they are on the safer side. For example, I have three grandparents who are currently alive, and for them to go ahead and get the vaccine was very, very important, because all of them are over 70 years old. So in that manner, for them, getting the vaccine gives them a sense of security and help, that they will not get infected and something will not happen to them. Now after that, what India started doing was, since people the old all old people were given the vaccine, they went ahead and started providing vaccines to everybody who was older than till 45. So people who didn't even have comorbidities. For example, my mom is someone who's above 45 years old but does not have any comorbidities. So for her to get the vaccine became very, very simple and easy. So that was the second set of people. The last set of people, which was very recently announced on May 1st, 2021, was the provision of a vaccine for all of those who are 18 and above. Now this drive is still currently going on. Everybody has not gone ahead and got the vaccine yet. We do have a concept of registering for the vaccines online and then providing for slots all over to go ahead and get the vaccine throughout. So the vaccination system will take a long time in India because of the number of people that are there in India. But it is very good and glad to know that there are so many people out there who have already got the vaccine, and there is a provision of getting the vaccine. And the fact itself that there is a vaccine available for the virus that we have all been fighting for. But till you guys who are very, very young right now, as well as someone like me who's over 18 years old but still has not got the vaccine, we all need to be very, very highly precautious of every move that we make, so as to not get infected and not harm anybody around us. It's okay sometimes that if we get the virus, because we will be able to heal out of it, but maybe someone around us may not be able to heal out of it. So make sure to take care of yourself as much as you take care of everybody else, so as to stay healthy and keep your society safe. Now I am so glad with everybody's illustrations and drawing of the preventive precautions precautions, preventions, and vaccination drives of everything happening all around the world and in India. I tried keeping the vaccination bit, in relation to India because you would understand it better, as well as you might have some family or friends or, uncles and aunts who are eligible to get the vaccine. So whoever is eligible, go ahead and tell them to go ahead and get the vaccine, because that is what is going to help them and you. So definitely ask your friends and family, whoever can, to get a vaccine as soon as possible. Apart from that, I hope you had a good understanding of the preventive measures and the precautions, and I hope you go ahead and start taking all of those preventive and precautionary measures, especially in this very hard time wherein we are all right now in lockdown, and it's a very hard time for all of us. So make sure of that. Before we end today's class, I want to talk about two things. One is the feedback program. Definitely going to be giving you some personalized feedback, so get selected as part of that top 10. So for that, do a good neat job to go ahead and submit out. Second thing, definitely, please go ahead and attend all of your classes. This is a time where you're in lockdown, you can learn, and you can get certificates. So make sure you go ahead and do that. Today's submission is basically going to be to go ahead and just upload the poster doodle drawing that we have done right now, and that is it. In tomorrow's class, we're going to be talking about the second wave of coronavirus that we have going on in India. It might be a little bit of a general knowledge information of everything that we are currently facing in India, and I do understand it might be a little hard on all of us since we are all facing it right now, but that's okay. I think it's time that we all know about everything that's happening around us, and hence we can take care of ourselves. So I'll see you in tomorrow's class. Have a look at the submission video if you don't know how to make your submissions. Bye bye.
Hi everyone, we are excited to have you here in today's fun-filled learning session at YOLO. Here is a quick look at how you can submit your work after the class. As a first step, go to live.yolo.com. You can use any browser to access this site. On this page, you will see a list of all our classes. Scroll down and you can see the Submit Your Work button. And then you will see a list of the classes that you've last attended, which could, for example, show the dance or craft or science experiment classes you've attended recently. Next, it will show you the list of children whose names are registered in this mobile number. Choose your name from this list to submit your work. For instance, if you are Satvik Kumar, choose that name. And then choose the class for which you would like to make your submission. For example, if you've attended the New Year's Masquerade Party session and you'd like to make the submission for this class, click on the Submit Your Work button below that. And then upload the photo you've taken. Choose the image from your phone and click Submit. You can scroll down and view all your past submissions and see how many of your friends or peers have liked your work. You can also see others' work and like their work to inspire your friends. If you want to showcase your work on social media, that too is very simple. Click on Share, copy the link and post it on Instagram or Facebook or any other platform of your choice. Just a tiny reminder, your submission looks a lot better if you could click a photo in the landscape mode rather than the portrait mode. Do not forget to tag us at YOLO_app. I'm eagerly looking forward to all your submissions.